Hello everyone, I'm Boo, and that's Bug. Our real names, you ask? No, that's what Mom calls us with love. My little sister is 6. She is so cute and so wise. She uses a wheelchair and speaks with her eyes.
Tell me what you want to play in the recliner. We already played Don't Wake Daddy. I decided to write a book called The Adventures of Bug and Boo, based off Hudson and Hannah.
Bug's wheelchair gives her freedom. Just wait and you will see. She has hopes, she has dreams. She is like you and like me.
Ready? So I wanted to go about it in a way that we could explain to children that we all are the same. We all have dreams, we all want to go on adventures, we all want friendships, we all want to be part of something. Hannah is your typical preteen. She loves to be social with her friends.
She enjoys animals. She enjoys like mermaid type stuff.
She loves pink, she loves glitter, anything that is really girly.
She likes to laugh at people when they fall or trip up. She gets a kick out of that.
Hannah was born on March 30th in 2012, and she came into the world as a beautiful, healthy little girl. As a mom, we always want to hear those words that everything is okay once we have our child. And she was healthy. Everything was fine up until a year. She was crawling, playing with toys, saying a few words, feeding herself. And then after her first birthday,
she just started to lose skills, and it was just confusing. You know, we didn't understand why that was happening.
She stopped pulling up on furniture as much. She stopped saying the words that she was already saying, like mom and baby. So we noticed that she was displaying a developmental delay.
So it was difficult to obviously see that happening for us as parents.
We went to different doctors, and at 21 months, she was actually diagnosed. So it was almost a year before we even got her diagnosis. My name's Denay Hooks, and my daughter Hannah has Rett syndrome.
The primary diagnosis is a clinical diagnosis where someone has this period of regression, loss of hand skills, loss of language, and motor, particularly gait problems. We confirm that diagnosis with genetic testing.
So when we got the clinical diagnosis back, I left work, I came home and, just hugged my wife.
It was absolutely devastating and heartbreaking, and we felt at a loss because we didn't know what the future held for our daughter.
Rett syndrome is a neurodevelopmental disorder that happens primarily in girls. It is the most common type of severe neurodevelopmental disability within girls. It occurs in about 1 in 10 to 1 in 20,000 live births, and it is primarily due to a mutation in a gene called MECP2.
Now, most of these cases are new cases, or what we call de novo cases. And what that means is that neither mom nor dad has the mutation, and they don't have other family members who have a mutation in this gene. So it's a one-off that happens in families.
Rett syndrome has classically been divided into 4 stages. The first stage is the period of normal development. The second stage is where the development plateaus. The third stage is where there's this active regression, loss of hand skills, loss of speech, and change in the way the child walks or loss of the ability to walk. And then the fourth stage is a plateau where they remain stable, will develop a little bit, regain some skills, and continue to develop some features, but no further loss of any skills.
Hannah's skills she is out of the regression phase with Rett syndrome and she has plateaued. So at this point, at 11 years old, she is not losing any abilities. In fact, with the help of therapy, she's able to do a little bit more. She is working very hard to be able to push buttons during therapy and sit independently. And we've been able to see that progress through therapy and being in this plateau stage of Rett syndrome.
So typical day. So fortunately, Hannah's in a position where she can attend school and returns home roughly 4 o'clock that afternoon, gets to spend time with family, gets to do therapy. At home, we try to treat her just like we would the rest of our children and just make sure that we keep her engaged.
Communication was probably the one thing that was the most important in our eyes, because I wanted her to be able to tell me her wants and her needs if she was hurting. So when we got the opportunity to get an eye gaze device, it changed the way our world was going to work, because as her mother, I know her and I know her answers and how she communicates because I've been doing it with her for so long.
So the screen is divided into different sections, and basically as a menu, she will make a selection with her eye gaze device based off of what she looks at on the screen. And then depending on what's in that next menu, she can continue making additional choices or back out. It has allowed her to express that in a way that we wouldn't have known otherwise.
People assume because somebody is nonverbal that they cannot communicate or they do not understand. And that could not be further from the truth when it comes to Hannah. She understands everything, and it's just a communication barrier that we've been trying to break through for years.
Rett syndrome's fourth stage is a period of stability, but during that stage, there are a lot of symptoms that emerge, and some of these symptoms cause the children to have persistent and worsening function. So tone changes so that they get contractures that make it more difficult to walk and to move. Their hand function becomes less and less over time.
Unfortunately, with Rett syndrome, a lot of the children who have it, individuals who have it, have seizures.
For some people, they're intractable and they are very frequent, and that makes it very hard for them to be awake and alert and interactive.
Hannah didn't have grand mal seizures. They were absent seizures, so she would stare off into space. And so it was hard to detect if she was having a seizure or not. But currently at 11 years old, she only has seizures at this point about 1 to 2 times a month. There for a little bit, she was having seizures probably once a week.
At the current time, treatment for Rett syndrome is primarily symptomatic. We mostly treat each of the symptoms as they come along. So if a person develops epilepsy, we treat their seizures. If they develop scoliosis, they go to orthopedics to have their scoliosis managed.
I've been working on Rett syndrome for over 20 years, and it's been a really exciting time to see the development and the progress that we've seen.
We're hoping that there are a variety of different gene-based therapies, as well as other small molecules that allow for improvement of symptoms and ultimately improvement of quality of life in individuals with Rett syndrome.
It's been so important and so valuable that there's robust patient advocacy groups for Rett syndrome. These organizations are also critical in, raising awareness of the disorder, making sure people understand, physicians, everyone understand what it is and be aware of it. And then they're also really important of raising money and investing in research to advance our understanding of the disorder.
I think one of the hardest things about having a child who is diagnosed not at birth but later on in life is seeing them do things that they no longer can do. At this point, it's still hard for me to watch videos where Hannah is saying mom because I haven't heard her say mom in 10 years. But I'm hopeful with drugs that are coming out. But if Hannah were to ever say mom again, I don't know what I would do. I can't imagine that that the next city over would hear me crying and wailing and praising, because just to hear her sweet little voice again would be a miracle to me.
We fade into the sunset. There's no more to roam. Our adventure was fun, but there's no place like home.
We recently signed a contract on our future home to build a fully accessible forever home for Hannah and our kids. And we are so excited because we worked very hard so that we could be able to accomplish this dream. And so Hannah's gonna have a house where she is comfortable, where she can grow old in. You know, at 11 years old, Hannah has changed more lives than most adults have. And it's the way she lives her life to her best ability, by going on adventures, by not letting Rett syndrome slow her down. I want people to realize that we all have a purpose. We are all here for a reason, and we're here to help others. It's not about us. It's about making this world a better place. And I love being able to watch Hannah be part of that.
So remember, my friends, to include everyone. You too can help others to explore and have fun. Go on adventures and discover new places. Always be kind and create smiling faces.
Right here. Is that cool?